With us is that expert I promised, Dr. John Voytas. How does somebody prepare, or how should they prepare for a doctor visit?
Well, I think it depends upon whether it's their first time visit or whether it's a follow-up visit. Because after all, if the patient and or their family is meeting the doctor for the first time, it's almost like kind of like going on a first date. You're trying to get to know each other. So for example, if a patient's coming to me to see me for a new physical, at that point, the doctor is just really trying to understand why is the person here? I need to get a good history and a good physical on the patient. Now, if you're having, let's say, a follow-up visit, let's just say that I've given you some medicine for your blood pressure, and you were to come back to me, Greg, a month later. At that point, the doctor's trying to get some information, and that is, how well did the medicine work? Were there any potential side effects? From a patient standpoint, and what makes the doctor's job easier, particularly on a first-time visit, is information. So if the patient can bring with them, and or their family could bring with them, any prior records, certainly any knowledge or any information regarding their medication, because that is so critical. And bring in all your medicines. I mean all your medicines, because I want to take a look at the medicines that your doctors in the past have given you. I want to know what you're taking, not only prescription, but also anything that's across the counter or herbal. Okay. So really the key is to provide as much information as you can to the physician, particularly if you're meeting for the first time.
What should I be doing to prepare for a follow-up visit?
Well, the first thing is make sure that you have the correct appointment. So first of all, come early and be on time. The other thing is that, again, if you know the reason for your visit, just on a little notepad or whatnot, mark some things down that in that time that you have with the doctor you think are important. It is okay to write things down to ask your physician. I think we as physicians, we tend to forget that, they don't have our knowledge, and it's very important to speak in simple terms, but it's okay for the patient and their family to ask good, direct questions. People think that, oh, I shouldn't ask the doctor this. He'll think I'm foolish or it's embarrassing or whatnot. Really, we're there to help. We're just trying to get information. So a little bit of preparation prior to that, making sure that it's the right day, the right time, being there on time. The other thing is that if there is some information to be discussed that's sensitive, let's say you have to go over some test results, and maybe the results are not going to be good, or maybe they're somewhat complex. It's always very helpful for the patient to bring a family member, a friend, a loved one with them. It helps to have that second set of ears.
Now, does that person have to stay in for the entire doctor visit, or can I move them in and out as the privacy matters?
You can move them in and out. What I'll oftentimes do is, during the physical examination, that's my private time with the patient. If there's some test results then that I want to go over with the patient, I'll ask them, Mrs. Jones, is it okay for your friend that brought you, or is it okay for your daughter to come in, and I say that as a second set of ears for me to explain, and if you or she has any questions, I'll be happy to answer that for you. The other thing is, in fact, we just had a case of this last week in which, again, I train other doctors to take care of the elderly, and the initial belief was that this older patient actually had dementia, which wasn't the case at all. They didn't have any problems with their memory or any kind of dementia. They just were not hearing. So it's obviously, we talk about making sure maximizing the senses. Bring your reading glasses. If you have hearing aids, bring those. And quite frankly, just for speech, if you have dentures, wear those. You can't assume that just because the person's not communicating with you that it's a memory problem or problem with dementia. The communication part of it, just like you and I are talking right now, is critical. And I'll be honest with you, the more I've done this medicine stuff, particularly in taking care of older patients, the key is critically in the doctor taking the time to listen to the patient, finding out what their needs are, making sure that your agenda doesn't supersede why that person came to see you in the first place. If you can do that, you can also build up the trust.
How does that make you feel as a doctor that I've got notes in front of me?
I actually appreciate it. The reason being is that, again, you have a limited period of time with any patient. And I'll be honest with you, one of the things that's different taking care of older patients, and my average age patient is 82 versus, let's say, someone your or mine age is just the time factor. It's very rare that I get a 15-minute blood pressure visit with a patient. There's usually other issues that are going on. So if we can lay those out right off the beginning, and I know what's on the mind of my patient, it actually makes it easier for me. And I'll go through a checklist. Did we take care of this? Your pain, some other issue. And at the very end, I always like to ask the question to them, is there anything else before I leave that we need to discuss that we haven't talked about? That really is a very good way of providing closure or opening up a further discussion.
What do you want to hear from me as an older adult?
Well, the most important thing is that what is it, why are you here, and how can I help you? And there will be times where I'll say to them, okay, we have a limited period of time here, and I may even say time is running short. What is it that I can most help you with today? I might have your blood sugar on my mind if you're a borderline diabetic, but for them it's Dr. Voytas. Really, the blood sugar can wait today. I want you to help me with this pain that's now not allowing me to go down into the basement to do my washer and drying. So you keep coming back to the issue of, okay, how can I best help you today?